Welcome to our 5 on 5. Please be joined by Roy Vinyard, the CEO of Asante. Roy, good to see you again. How are you today?
Thank you. I'm well.
All right, so let's first start with the purchase of the former Ashland Community Hospital. How is that going now under Asante's care?
Well, as I think you know, this affiliation was effective as of the 1st of August, so it's still relatively new, but I think going quite well. We've begun to integrate a lot of the functions into and with Asante. We're learning some things from Ashland Community Hospital that we can use throughout the rest of our system. Sure. And likewise, I think we're bringing some things to Ashland Community Hospital that they can use as well that we've learned over time. So the transition, I think, has been very, very smooth. Our missions are very similar and very much aligned, so I did not anticipate it would be difficult, and it hasn't been.
Oh, very good. Glad to hear it. So what about Rogue Regional and Three Rivers? Anything happening at those two facilities?
Well, there's always a lot happening in healthcare because of all the changes that healthcare entails nationwide.
Right.
And I think we're busy just preparing for a future state of healthcare. We're busy helping to recruit physicians to come into the Valley so that we can take care of our patient population. We're looking at reducing costs, continuing to increase our quality of care. So it's an ongoing day-to-day.
Always looking for improvement.
Right, exactly.
Okay. I do want to ask you about the Affordable Care Act and AKA Obamacare, but first, since we're talking about facilities, any chance that you guys are looking at Sutter Hospital in Crescent City?
Yeah, I think that Sutter Coast Hospital has kind of gone through their phase of looking at what the next step is for them, and I think that the Sutter Health System has come to terms with Sutter Coast Hospital, and they will be staying within the Sutter Health family. That said, we've always had a close relationship with Sutter Coast Hospital and with other hospitals within our 9-county service area, so there are a lot of patients that come from Crescent City and the county that we'll continue to take care of. We enjoy a very good relationship with Sutter Coast Hospital, and I think that will continue.
All right, very good. Well, we'll pick up after the break with the Affordable Care Act. Stay with us. We'll be right back. Welcome back to our 5 on 5. Again, we're here with Roy Vinyard, the CEO of Asante. So, Mr. Vinyard, how has the Affordable Care Act or Obamacare changed the business for you guys?
Right. Well, you know, I think there's a lot of confusion, a lot of anxiety around the Affordable Care Act and what it means for individuals in terms of their ability to get health care in the future. I think looking at it from a positive perspective, the system that we had was not working very well. There were out of control costs, a lot of duplication of services, difficulty in getting a provider to take care of you, a lot of people who are uninsured. And I think whether you like Obamacare or the Affordable Care Act or not is not really the issue. The issue is that we had a system that wasn't working well. We're moving to a system now that will provide more coverage for more people, that will better coordinate care between inpatient and outpatient, that should lower the cost of care or at least decrease the increasing cost of care. Those are all good things. We're preparing for those things. We're bringing in more physicians to handle the increased demand for healthcare services. We're better coordinating care from inpatient to outpatient. Those are all good things for the communities that we serve.
Okay. All right. Now, last question, very, very general one. What advice would you give people in their relationships with doctors and hospitals?
Right. Well, you know, you're the main person in charge of your health care. You make the final decision. So I would say don't be afraid to ask the question. Don't be afraid to be involved in your own care, decisions around your care. You know, the best thing is to, if you're in doubt, ask.
Very good. No such thing as a stupid question.
That's correct.
Good to see you. Thanks for coming.
Thank
Appreciate
you.
it.
Enjoyed it.
Stay with us. We'll be right back.